Welcome to this quick guide on biosimilars. It will explain what biosimilars are and how they are being used in cancer care.
To understand what a biosimilar drug is, you first have to know how drugs are made. There are different types of drugs used to treat cancer. Many drugs are made from chemicals. Aspirins and chemotherapy are two chemical drugs. Other drugs are called biologic drugs. They're made by or from living cells or tissue. Some of the newest drugs used to treat cancer are biologics. These include immunotherapies and targeted therapies. Biologic drugs are much larger and more complex than chemical drugs. Because they are so complex, different batches of the same biologic drug have small differences. These differences do not affect how it works in your body. So now that we know what biologic drugs are, what are biosimilars? When a new manufacturer wants to make a copy of a biologic drug, they make a biosimilar. In the same way that each batch of biologic drugs is very similar to others, biosimilars are also very similar to the original biologic drug. A biosimilar is a very similar copy of an original biologic drug. It is given at the same dose and for the same purpose as the original biologic drug. Biosimilars work the same way in your body, are just as safe, and have the same potential side effects as the original drug.
In the United States, the Food and Drug Administration, or FDA, must approve a drug before it can be prescribed by a doctor. Drug makers conduct laboratory studies to develop new drugs. Then, the drugs are studied in humans in clinical trials to learn if they're safe and effective.
Before the FDA will approve using a biosimilar, it must undergo a series of tests, including clinical studies that will show that the biosimilar will be made at the same dose and strength as the original biologic product. The biosimilar must meet FDA's rigorous standards, be made in licensed facilities, and be monitored to ensure quality. Biosimilars must work just as well and be just as safe as the original biologic product. The FDA has approved biosimilars to treat a number of cancers, including certain types of brain, breast, cervical, colorectal, gastric, kidney, leukemia, lung, lymphoma, and ovarian cancers. They have also approved biosimilars to stimulate blood cell growth in patients receiving cancer treatments.
To know if a drug is a biosimilar, it helps to understand the way drugs are named. Every drug that's offered to a patient has a trademarked brand name and a generic name. Let's use Tylenol as an example. Tylenol is a brand name for a chemical drug whose generic name is acetaminophen.
A biosimilar will have a different brand name than its original biologic drug, but a biosimilar drug will have the same generic or core name as the original drug, followed by a dash and 4 letters, selected by the FDA at random.
A doctor writes a prescription for a specific drug. If it is a chemical drug, pharmacists can switch out a generic drug for a brand name drug without talking to your doctor. If you're prescribed a biologic drug, your pharmacist may need to talk to your doctor before they can give you a biosimilar instead of the original drug. If you need your prescription changed to a biosimilar for insurance purposes, the pharmacist may need to notify you and your provider before you make the switch. Laws vary by state. Check with your pharmacist if you need your prescription changed. Biosimilars have been used in the U.S. since 2015, but they've been approved and used safely in Europe since 2006. The retail price for a biosimilar in the United States may be about 15 to 30% less than the original drug. The cost to you for either the original biologic or the biosimilar may vary. Talk to an oncology social worker, financial navigator, or another member of your cancer care team to find out what your options are. The hope is that biosimilars may improve a patient's access to care, increase treatment options, and possibly offer price savings.
Let's hear Dr. Leah Crystal from the FDA talking about the future of biosimilars in cancer treatment.
in that space, and we have a number of development programs to cancer therapies that are ongoing, and I expect that we'll receive more marketing applications, which will hopefully lead to more approvals for cancer therapies, and again, have that competition in the marketplace, which will hopefully drive down costs for healthcare.
Managing the cost of your cancer treatment can be costly and overwhelming. To learn about managing the cost of your care, visit www.cancersupportcommunity.org/cost. You can also call the Cancer Support Community's helpline at 888-793-9355. To learn more about biosimilars, visit www.cancersupportcommunity.org/what-biosimilar.